Thank you. Yes, really happy to be here, and not talking about raw food or feeding, but I would like to say in the starter that obviously food has a big impact on our working dogs and their well-being. So hopefully in the future we can have some research on what affects the scent and the dog's abilities to work with people, humans, and so on. Yes. My name is Nona Borgström, and I have been working at DogRisk for a few years now. And we have been training kind of a new genre on dogs for alerting pain in humans. And then we have furthermore seen that actually dogs are like sensors, and they can actually alarm a lot of things, just kind of like the changes in the human body, kind of like, yeah. And where is Robin? I think I have the same problem as Manal had yesterday, that no, it went, okay, good. So what is a pain dog? It's a dog that's trained to alarm upcoming pain attacks. And the idea is that the pain attacks are kind of like going up and down. It's no idea to have a dog that says that you have pain all the time. So it's a kind of like arousal that the dog is alerting. And what it gets is that we can get on to the non-medical pain treatment, and the patient gets these social situations kind of like backed up by the dog, because when the dog is alerting, you know that you can have to stay at home or take care of your pain, or then others you can be free to go. And these are kind of a list of things that we have been looking at of what can be of help to the patient. And it's of course that you can anticipate the pain, you can know before you can kind of like feel it, you know that, okay, it's coming a pain attack. And you can learn from these things. You can have early interventions to reduce pain medication. We have patients that have like not gone with ambulance at all after they got the dog. They have had a reduction in using pain medication, and that's really good for their kind of like everyday life. And I think the most help of the dog is like an overall thing. It's the pacing of the day. It takes the person out. It helps with the pain. People can approach you, come and talk to you, even if you're maybe sitting in a wheelchair and you're a bit different looking. So there are a lot of things that you can kind of see in the help of a dog. The examples of the dog's ability to alert from earlier on is like the dog can predict migraine, spasm, neuropathic pain, ischial pain, CRPS pain, inflammatory joint pain, where maybe actually in the joints you can see that the dog can go and point the place where the pain is actually located. And from earlier on, probably for everybody, diabetes dogs are something that we all know of, epilepsy dogs, narcolepsy, migraine, POTS. So we have kind of a list of dogs earlier on that have been working with people with these kind of medical conditions where you need to alarm something. And I would like to say that the dog isn't telling you some diagnosis, and it's not telling you to take any medication. The dog is kind of like there to, like a sensor with you, living with you the everyday life and helping you out to do good decisions. And this is a good study that we have been using a lot, because kind of like when people say that, you're the dog trainer and you train these dogs. And I usually say that, well, actually, I don't train the dogs because they know it's already. We are not kind of like the communicators. We talk a lot about this dialogue, that you need to be better at learning to read the dogs. As you can see, 26% of this quite big sample of dogs were able to predict migraine before it came. So, I mean, it's really actually nothing that we learn. We learn to read the dogs, we learn to treat the conditions, and it makes sense to the dog, and then you have a good kind of like living together. And the spontaneous things that the dog does are listed here, and it's usually so that when you talk to a pain patient who has a dog, and they say that, wow, it's really, that can dogs really predict pain, and that's interesting. And when you start talking with them and you say these examples of things that the dog does, then they are like, yeah, but my dog does all of those. And then you're like, and then you just have to start reinforcing the behavior and treating yourself. So it doesn't help if the dog is coming to you and staring at you in a standby and you're not doing anything that makes sense to the dog. So you have to kind of like, when the dog comes up to you and looks at you, then you go lie down, or you take some medication, or you take a blanket, or you do something that helps you individually with the pain, and then the dog can kind of like get a hint of that, okay, I can talk to my person, she understands what I'm saying, and then the condition gets better and the scent is not present anymore. And in the beginning, we are talking about 2015, we trained the first pain dog. At that time, it was an assistant dog accredited in Finland. And we were not sure that is it a smell or is it something in the behavior of the person. First we thought that it was like yawning, and it was something in her expressions that made the dog kind of like do these decisions. But then quite early we could see that the first dog that we trained started to alert other people as well. And usually these dogs go and smell in the mouth area, in the breathing. That's what they are interested in. And so we think that it's biomarkers, some trait of them, but obviously we don't know which one of them are higher and which ones are lower, but some kind of change in the body is what the dog can predict. And the difference, I have been working with assistant dogs for maybe 20 years, and with therapy animals and social rehabilitation with horses and dogs for 10 years. And the funny thing with this is that this you cannot tell the animal. You cannot say that sit or put on the light or bring me my phone. You cannot do that. So it's kind of like the change in the body, the smell is the cue for the dog to react. And that is why I think it's really a dialogue, and that's why we really have to take care of this kind of non-human-human interaction. It has to be in a good kind of like this balance all the time, because otherwise the dog's empathy for the person is not present. So it has to be a good bond. It has to be a good kind of like well-being in the dog. And obviously the behavior, you need to train so much that the dog can like not be disturbed when it's in the mall or somewhere. It has to be able to pick up the scent and be able to say to the person that, hey, it's something here now. It has to be a little bit of a bold dog there. But if you have a kind of like a dog at home, then maybe the stressors are not that much present, and then the dog can maybe work as well as home only. And we have worked up this system that's kind of like a little bit from animal-assisted interventions and from the assistant dog world, that you have a dog and a handler, and then we have the social and healthcare team and the dog trainer, which in our case has been that everybody has had a social and healthcare degree as well. As we didn't want in the beginning to promote people to use more medication or kind of like get this situation where the dog is saying that, hey, take more medicine. That's obviously not our part. We are talking about One Health, and we're talking about non-medical pain treatment, and there we need the whole team. And this is because it's good to learn Finnish, so I didn't change this table, but this is just a picture of how many different professions, from doctors, social field, physiotherapist, occupational therapist, we have in the whole of the working with the pain dog and the patient, so it's a lot. And I talked about the human and non-human partnership, and I think I kind of like ticked these boxes already, but the dialogue is the important part. Well, how does the dog alert for the behavior? In the beginning, people said that, okay, but the dog looks like it's just wanting food and it's not like alerting. But we have different types. It's a nose touch in the hand, or it's not a paw touch. We pick that away quite early, so that it doesn't come any injury from that. But the button and bell has been really good. So we have a button in the wheelchair, a button in the wall where the dog can go and push when the pain is arousing, and then the person knows to react. And also, some of these dogs have this additional training that they can do, like bring medicine or bring some cold pack from the fridge. And people usually ask that, do they kind of like shut it? And yes, they shut the fridge as well. We don't skip that part in training. Yeah. And after the alert, it's up to the person to kind of like do something to their pain situation. So the person needs to figure out what to do, obviously related to place and time. You cannot lie down, but you can kind of like maybe take a little moment where you meditate or you do something that gets you feeling better. Or just change a position, a hand or a foot, put on a tense machine or whatever helps the person. And usually when the pain is kind of like in good control, the dog goes and lies down. So it's more of a sensor. It gets up when the pain comes, it comes and alerts, and when the pain is kind of like in a better position, then it goes and lies down again, and you know that, okay, you're good to go. You can continue with whatever you're doing. And it's nice to read about these new articles and new findings of empathy in dogs, because this has been something that we have been talking with the police guy, Ilkka Hormila, in the beginning of this pain dog project, that actually it has to have something to do with empathy as well in the dogs, why they are so keen in alerting and wanting this balance in their own humans as well. And we have kind of like in this project two kind of dogs. We have the pain dogs that are personal medical aids. We have 8 of these dogs, and then we have 2 clinical dogs that are working with physiotherapists. One is at the pain hospital, and the other one is working in the field with this physiotherapist. And there's a little bit of differences in these 2 guys. So the pain dog works in everyday life and 7 days a week and is living with this person, and also attending in physiotherapy and such, so we can kind of like get the whole package in these dogs. out. Here are some thoughts that are shared from these patients, that what do they think that they get out of these dogs. And I think one of the most interesting findings has been that persons that have had an assistant dog for many years say that the ability to alert pain is the most important work task that these dogs can do. So it was really a good marker for us. And somebody has said that they could not think about living without a pain dog anymore when they have had the dog in their life. And also kind of like the dog has opened a new world for understanding. Kind of like when you have pain and you say to persons that I have pain, and somebody looks at you and say, okay. And actually, do they understand? Do they kind of like get the feeling? So we have had a lot of patients that when the dog is alerting, they start to cry in the beginning, and they say that finally it's somebody that really understands me and sees me for who I am, and that I have this pain. And it has also led to that you have been able to, in like psychotherapy and places like this, move forward a lot. Of somebody said that we hopped 5 years when the person got a dog, and that was really nice to hear. And then the clinical dog, how it works or how it has its spare time in the physiotherapist room. So the things that we have seen there is we have had some good results in this visual analogic scale for pain, that when they come into the room, which level of pain they're in, and when they have the session with the dog, how the level of VAS comes down, and as well as this functional scaling when we have had aims for them, and they have given numeric numbers for these. We could see that the dog's presence alerting the pain in the physiotherapy has been of help for some patients. And they have found really good non-medical pain treatments. It has been like you have this tapping and you have eye movement and you have different things you can do for non-medical pain treatment. And with these dog sensor abilities, it has been really great to follow, because for some patients, you can see that the dog, maybe you are doing eye movement, and it's something that's not just good for the individual body. And when you start doing tapping, the dog goes and lies down, and then the physiotherapist knows that, okay, maybe this is better for this patient. And this is some kind of information that we could never have gotten out without having the dog present there. And obviously, we have had these comments, I took some away, but we have had these comments that somebody has said that you have to be a really nice person. I trust you as my physiotherapist because you're so nice to the dog, and the dog is so nice. So you can kind of like see this nice circle as well. It's not just about the pain, it's not just about the alert, it's about the whole overall thing with the oxytocin and everything that you get there. As well. And we have been doing collaboration with the Finnish Guide Dog School. Without that collaboration, we would have never done 10 dogs with so little funding and so little time. So we are really thankful for them. And as well, we have been we have this PAWS project, People and Animal Wellbeing at Work and in Society, and our funding is partly for strong social impact in the society, and that's where this project kind of comes in as well. So we have done a law proposal for the Parliament to get the medical alert dogs to be promoted in the same position as assistant dogs and guide dogs. And I'm also working in the Parliament group promoting the animal-assisted kind of like intervention work. And they also kind of like combine a bit with this clinical dog, as you heard earlier. And then we are kind of like inventing new ways of speaking to animals and having them as non-human collaborators or non-human co-workers in the different organizations. And we are looking at animal welfare and kind of like in these working dogs, we are doing a pilot project for them and trying to find out how they are doing and how we can listen better to them so that we can continue kind of like having the ability to have dogs as help in the society so that both human and dogs are feeling good. And some take-home message is that it's the interaction, it's the trust between the dog and the patient. It's good to have a degree in social and healthcare for most of the people working around these things. We have seen that peer support groups in these persons' lives have been impacted. They have said that these peer support groups from the dogs groups have been really good. So that's good. And kind of like the willingness to be present and being bold enough to do new things, I think that's really important. And I want to thank Anna for trusting and believing in me. Thank you.